If you're noticing increased tooth trouble, you're not alone. Research shows pandemic stress is taking a toll on people's teeth through clenching and grinding.
And this can have major repercussions on our overall health, which is why some dentists are now advocating for better communication between healthcare providers. Here's the story.
One day while I was eating dinner, one of my molars just literally broke in two.
The painful experience came as a complete shock to Suzanne Farrow. While her job as a music teacher has drastically changed over the past 15 months, she thought she was properly managing the stress of the pandemic.
I figured, okay, well, I'm dealing with this and everything's going fine. And then it turned out that I wasn't, and I was taking it out of myself when I was sleeping.
And Farrow is not alone. Studies show that dentists in multiple countries have been seeing a significant rise in stress-related conditions. According to the American Dental Association, cases of grinding and clenching teeth are up 71%, while there's been a 63% increase of chipped and cracked teeth. And patients are reporting symptoms like headaches and jaw pain 62% higher than normal. In Canada, dentists are also noticing these same trends, including an increase in the need for bite splints.
It's the first time in my 40 years of practice that I've seen this type of stress and its effects on population.
When Dr. Stephen Abrams' practice reopened last June, he says about 65% of the emergency calls from patients were for cracked or broken teeth. With oral health a key indicator of overall health, this has left him with a number of concerns.
If stress is impacting my patients, the ones that we were seeing weren't stressed before, what other parts of their body are also taking the stress? And will we be seeing an increase in cardiac issues, lung issues, and other parts of the body because of the fact that these people have been dealing with the stress in this particular way?
Dr. Abrams says signs to look out for include feeling pain in the mouth when chewing in a particular way, or whenever there's a temperature change in food or drinks. For Farrow, not catching the symptoms earlier led to a ton of dental work, including 2 root canals and multiple fillings replaced.
It's a good idea to keep a close eye on things, and I probably should have spoken to my doctor sooner to find out about ways to handle all of the changes that happened as a result of the pandemic.
Oftentimes, patients aren't even aware they're feeling stressed out, which is why Dr. Abrams is keeping an even closer eye on them, especially the younger ones.
When you ask them how they're doing, they begin to tell you, I'm finding it difficult, I'm very lonely, I don't see my friends. They really were having a tough time. So that the cracked tooth really becomes that searchlight that you can then use to say, wow, you're really stressed. Now, how can we help you?
He describes dentists as being the first responders when it comes to oral health and other health-related issues. Often, built-up stress initially manifests itself through pain in the teeth. But once that's treated, the next question becomes how to go forward and manage the stress that caused it.
My vision would be that if I see the patient with a cracked or broken tooth, could I then communicate directly with the family doc to say, look what I found, how can we deal with the patient, and what tools do we want to use?
Right now, Dr. Abrams points to a disconnect between health providers. He says creating a stronger link between dentists and physicians will benefit the overall treatment of stress in a patient, which ultimately starts with them acknowledging it exists in the first place.
I hope that if anybody else has problems like this, they make the time for themselves to go and seek out the resources that they need, because it can be very time consuming, and we do often tend to put ourselves and our own personal needs on the back burner.
Hoping others don't have to learn the hard way like she did, that biting off more than one can chew can be a painful but avoidable situation. Miranda Anthistle, Global News, Toronto.